Dr. Mark Gilbert is a community medicine specialist at Clinical Prevention Services, BC Centre for Disease Control, where he leads the epidemiology and surveillance and online sexual health services programs. In addition to initiatives to enhance current surveillance, his areas of interest include testing for HIV and other STI, internet-based approaches to sexual health promotion, and gay men's sexual health. Dr. Mark Gilbert.
Thanks, everyone. Rick asked me to come back this year. Some of you recall, if you were here last year, I spent some time as part of one of the plenary sessions going over some of the process and the data that we were looking at to generate a provincial health officer's report on the current state of the HIV epidemic amongst gay and bisexual men. Since last year, we've then gone through a process of coming up with recommendations based on that data, on that analysis. And so that's what I'm going to be presenting to you today, these recommendations. So just to point out, so the provincial health officer is within the Ministry of Health. Perry Kendall is his name. He's sort of at a arm's length distance from the Ministry of Health, and he releases formal reports that make recommendations to government. And so he has, so we've been working on this report, which is going to be released in early 2014. It's actually being released as one of his formal annual reports, not just as a technical report, which is good. It gets a lot more press and a lot more attention. It's formally presented to government, but it does make it quite a bit longer in the production. But as part of the process, we established sort of two advisory processes involving community groups and public health and clinical advisory groups of about 60 people who participated at various points in the process. And really the recommendations from that advisory groups comprise the report. And Perry has endorsed all of the recommendations in the report, and those will be the ones that I'll be sharing with you today. So just in brief, just to tell you the conceptual approach which we used for the report did actually draw on some elements of life course theory in terms of how we were looking at the data. We also tried to frame the recommendations using sort of this socio-ecological type of model, really trying to look at both factors that are at an individual level that affect, behavior and testing, for example, and then things in sexual networks, and then expanding into sort of relationships, communities, and then finally getting to sort of social and structural determinants or drivers of the HIV epidemic. So just to tell you what some of the key sort of concluding messages are of the report, so that after this sort of review of the epidemiology, talk about how the epidemic is complex and there's no simple solutions, clearly pointing out that while there are similarities, there are fundamental differences compared to other populations affected by HIV, and there's a clear need to focus on gay and bisexual men in BC. Recognizing that gay and bisexual men are not a uniform population, but have diverse social and sexual groups. Clearly stating that the traditional public health approach, which is focused on behavior and reduction of risk, and treatment is in that context of reducing risk or reducing incidence, are important, but no longer sufficient. And so there's a need to keep these and retain and expand, but also to be more comprehensive and use multi-level approaches. Clearly calling out the need for partnership between government, community, and researchers, and really highlighting, we've tried to make it really clear in the report that gay and bisexual men were the population first affected by HIV in BC, the first to mobilize and with demonstrated resiliency, and that's sort of one of the clear messages that we have tried to incorporate into the report, and that gay and bisexual men need to be empowered and meaningfully involved in the continued response. So the report identifies the following best practices for implementation. So meaningful involvement and leadership by gay and bisexual men, and that must involve HIV positive men. Using positive assets or strengths-based approaches, involving where possible or feasible online approaches that will help to reach men perhaps not in very urban areas, but that are still then linked to regional on-the-ground services. That while there's a need both for services that are specific to gay and bisexual men, as well as a need to be thinking more generally, for example, within other sectors of the health system, to improve reach and engagement of services across the board. And as well to be responsive to the epidemic. The epidemic does change over time, and that's something that we need to recognize and respond to. The report emphasizes 6 subpopulations that we describe as facing additional vulnerability, and so where there's additional intensity that's needed of programming. That includes HIV positive men, Aboriginal and Two-Spirited men, other ethnocultural minority men, young gay and bisexual men, men in suburban, rural, and remote regions, and gay and bisexual men in active sexual networks. So the recommendations, so these are, this is a very sort of a speedy overview of a fairly lengthy section of the report. So I apologize, it's just kind of scraping the iceberg, and I'm happy to talk to you in detail about any of the content. But there's two recommendations that are more at a policy level. The first recommendation is to develop, implement, and monitor a provincial HIV prevention work plan for gay and bisexual men with BC that will be integrated within the provincial Stop HIV program. So some of you know the provincial Stop HIV program, which is really reflecting a ministry document called the Hope to Health Strategy, which was released last year. And so this recommendation really calls for alignment, and not just alignment, but actually a work plan with teeth, so with resources, commitments, goals, objectives, that's done in partnership and if not led by community agencies, community members. The second major policy recommendation is recognizing sort of syndemics and the commonality of all, like what we've been talking about these past few days, to develop a long-term provincial health strategy for gay and bisexual men. So HIV prevention would be one aspect and an important aspect of that, but it would be a broader provincial health strategy that would encompass social and structural determinants as well as other health issues of importance. The second main group of recommendations, then, if you remember that conceptual framework, are really focused at the individual and network level. The first being to expand HIV testing to increase uptake and frequency. That would use both targeted and routine approaches in a variety of settings. So building on established successful models as well as trying new innovations. The second main recommendation in this section would be to continue to support biomedical approaches to HIV prevention. So that includes condoms, PEP, PrEP, and HART, retention and engagement in HART. So that's sort of treatment as prevention, working its way into this recommendation. And third, to promote sexual health by using a sexual health framework that goes beyond just HIV and STIs and behavior, that also incorporates physical, social, and mental aspects of sexual health. The third group of recommendations are really trying to address community and drivers at the levels of community and relationships. So the first being supporting the central role of HIV positive men in HIV prevention, looking at skills building, things like peer navigated programs as examples. To implement regular periodic health promotion and educational campaigns for gay and bisexual men across BC. One of the immediate ones that was flagged was a need to be thinking about campaigns related to things like viral load and prevention. And these would be meant to be evaluated, potentially adapted for use in different regions, and to be done in a sustained way over time. There's a fairly significant emphasis in the report on better meeting the mental health and substance use needs of gay and bisexual men in British Columbia, and really trying to align this with the Healthy Minds, Healthy People plan that if some of you are in Travis's presentation that he talked about. And this is a 10-year plan from the government of British Columbia. And so these recommendations are really tied to the structure and format of that report to try to give it more teeth. And then finally, engaging and supporting communities of Aboriginal, Two-Spirited, and other ethnocultural minority gay and bisexual men. And so some of the recommendations within this section, for example, will include addressing some of the legacy of factors like residential schools, intergenerational trauma, as well as focusing on new immigrants, racism within the gay community, as well as homophobia within ethnocultural minority communities. Fourth section is related to addressing social and structural drivers. And so the first is related to the health system in general, and it's really, this is a bit of health government speak, but it's about improving capacity of policies, programs, and services to reduce existing health inequities. There are a number of provincial policies for improving health equity and quality, and so this recommendation has been framed specifically using that language in order. And so it's not just about sort of creating unique services again or gay-friendly spaces, but also working. It talks about things like organizational policies or supporting gay men as well to be able to navigate the healthcare system appropriately. The second in this section is supporting initiatives that aim to reduce stigma and discrimination associated with HIV at a societal level, including things like stigma reduction campaigns. This is also where there's some clear recommendations around how public health legislation is the preferred way to deal with cases of non-disclosure of HIV status versus criminal legislation, for example. And then finally, promoting positive mental health and well-being for gay and bisexual men of all ages by fostering safe and supportive environments. And so that talks specifically about families, schools, youth coming out groups, as well as workplaces as sort of examples of the kinds of environments that are within this set of recommendations. And then finally, there are 2 recommendations around monitoring, evaluation, and research. The first being to establish ongoing monitoring to identify changes in trends and population dynamics. That really emphasizes, for example, community-based methods of knowledge generation and evaluation, like the Sex Now survey. And then finally addressing key gaps in research, both in terms of specific knowledge gaps as well as prioritization of research for gay men related to HIV prevention. And there are a number of sort of research priorities that have come up out of the consultation that will be included in the report. So that's just a quick overview of where things are at. And this is something that should be coming out early next year. I certainly want to acknowledge that many of the people in this room have been part of this process since the beginning, and I really appreciate your support and your thoughtful contributions. Also, I really don't want to see a report that's full of stock photos of men holding hands and pride flags. So if you have any images or posters or things that would be safe for work, it is a government report, please send them my way so we can, I would greatly appreciate it. Thanks.